What's up, Easy Fam? Welcome back to another practice video with me. Welcome back to the channel. If this is your first time here, you're highly welcome to my channel. Please do well to like, comment, subscribe, turn on your post notifications so that you're notified when next I make a post. Don't forget to check out my playlist, ASCP Preparatory Guide. That playlist has a lot of videos concerning the initial phase of ASCP and everything you need to know while preparing for the ASCP exam. I've been getting a lot of DMs from people that have, recently written the ASCP exam, and I must say that if there were 100 of them were successful, and I'm just so happy, and I'm so excited for them, and I'm so excited that whatever I'm doing here is getting to help a lot of people out there. So one more thing, guys, don't forget to share this channel to your friends, your families, whoever is interested in writing this ASCP exam. Please share my channel with them and to them so that they too can be able to enjoy the benefit of just getting free information, because literally I'm not paid for this, but I'm just doing it because I want to, and I'm getting the results. People just telling me that their exams were successful. I've gotten I think 5 people messaged me this week that they wrote this week, and all of them passed, guys. All of them passed. So I'm super excited. Anyway, without wasting much of your time, let's dive right into the content of today. So today I will be doing a practice questions on chemistry of the BOC guide, and we'll be targeting most of the ASCP related questions rather than the just normal questions. And with that being said, let's get into the video, guys. So question number 1 says, following overnight fasting, hypoglycemia in adults is defined as a glucose level of what? A, less than or equal to 70, B, less than or equal to 60, C, less than or equal to 55, D, less than or equal to 45. So I'm just going to give some time, like I did in microbiology, for people to find the answers or think about the answers. And time is up. So the answer to that question is D, less than or equal to 45. That's what hypoglycemia is classified as, and you can find that in Success Textbook on page 29. So you find out that hyperglycemia is a fasting level, right? Overnight fasting level greater than 100, and hypoglycemia is less than 50, and 45 is less than 50. So the answer is D. Second question. The following results are from a 21-year-old patient with a back injury who appears otherwise healthy. Whole blood glucose of 77, serum glucose of 88, CSF glucose of 56. So a whole blood glucose of 77, that's okay. A serum glucose of 88, that's okay because the reference range is 70 to 99, and then a CSF glucose of 56. So that's also okay because CSF glucose is 2/3 of the serum glucose or plasma glucose. So if we say 2/3 of 88, that's 2/3 of 88, that's times 88. I think we'll get about 58 or so, and this is 56, so that's also okay as well. So the answer to this question is I'm sorry, I didn't give time to answer this question, but rather the answer to this question, I think I've already said it, is all values are consistent with a normal healthy individual. I guess you guys know how I brought about that, and you can find all these information that I just said on page 101 of Bottom Line Textbook. Guys, don't forget to check out my ASCP Study Essentials. This will give you an in-depth insight on the textbooks that I used for each subject. So this textbooks that I'm talking about now, I spoke in much more length about it in that video, so don't forget to check out that video. I will be placing the link or something at the end of this video, so you can just click on that and then move and watch that video, because it will be very important for you in this practice video questions, right? So question number 3, let's move ahead, guys. We have the preparation of a patient for standard glucose tolerance test should include what? A, high carbohydrate diet for 3 days, B, a low carbohydrate diet for 3 days, C, fasting for 48 hours prior to testing, and D, a bed rest for 3 days. And time's up. The answer to this question is a high carbohydrate diet for 3 days, and you can find that on page 32 of your success textbook. So let's move on to the next question, guys. So the next question says, a pregnant woman with symptoms of thirst, frequent urination, or unexplainable weight loss should have which of the following tests performed? A, torbutamide test. B, lactose tolerance test. C, epinephrine tolerance test. D, glucose tolerance test. Time's up. The answer is glucose tolerance test. You can find that on page 32 of success, because there's something called gestational diabetes mellitus. That's diabetes when the woman gets pregnant. Some people do have diabetes when they get pregnant. So yeah, a glucose tolerance test will be required for her to do to rule out all possibilities of gestational diabetes. So the next question says, hemolytic anemia, or a patient with hemolytic anemia will A, show a decrease in glycated hemoglobin value. B, show an increase in glycated hemoglobin value. C, show little or no change in glycated hemoglobin value. D, demonstrate an elevated hemoglobin A2. So yeah, I'm giving you guys time to answer the question. That's why I'm keeping quiet. So if I'm to answer this question, I would say the answer to this question is show a decrease in glycated hemoglobin value. And why do I say this? I say this because glycated hemoglobin, that's the number of glucose attached to hemoglobin, right? And when there is hemolysis, there is breakdown of glucose, and HbA1c is a test done to check the mean value of glucose flowing in the system, like in the past 3 months. That's like 90 days, right? And then the lifespan of red blood cell is 120. So when there is something called hemolysis, there is there's a shortage in the lifespan of the red blood cells, right? So red blood cells get destroyed before they even get to that 120 days, and then the HbA1c is supposed to check the mean value of the glucose attached to hemoglobin in a span of like 3 months, right? That's 90 days. And if this blood is destroyed before it even gets to 120 days, it will also in a way affect the hemoglobin value, because it will bring about a false decrease in the hemoglobin value. In this case, the glucose doesn't have much time to accumulate in the body, and this will bring about like a false decrease in the hemoglobin value. So hemolysis causes a false decrease in hemoglobin value. And yeah, so that's the reason for my answer. I can't really say a particular page you can find it in a textbook, but it's just about reasoning it and knowing that hemolysis, glycated hemoglobin, hemolysis. Yeah. So the next question says, severe diarrhea causes A, metabolic acidosis, B, metabolic alkalosis, C, respiratory acidosis, D, respiratory alkalosis. And time is up. The answer is metabolic acidosis. Anything that has to do with metabolic acidosis has to do with the kidney, right? Metabolic has to do with the kidney. Respiratory has to do with breathing. So in this case, there will be a decrease in bicarbonate, which will drive the body into a state of metabolic acidosis. So the answer is metabolic acidosis, guys. Next question. The Burette reaction for the analysis of serum protein depends on the number of A, free amino group, B, free carboxyl group, C, peptide bond, D. Tyrosine residues. And time is up. The answer to that question is peptide bond, C. So it's just the Burette reagent is for protein. So protein, peptide bond, polypeptides rather. I'm going to say peptidoglycan. Polypeptides joining together of many peptides and all of that. So it's about the peptide bond, right? Next question. The principal excretory form of nitrogen is what? A. Amino acids. B. Creatinine. C. Urea. D. Uric acid. And time is up. The answer to that question is urea. You can find this on Success page 27. Page 27 of Success textbook. So the next question. Which of the following represents the end product of purine metabolism in humans? A. AMP and GMP. B. RNA and DNA. C. allantoin. D. Uric acid. Time is up, guys. The answer is D. Uric acid. You can find that on page 28 of Success textbook. Next question, guys. The next question and the final question for this section of chemistry practice questions is: the troponin complex consists of A. Troponin C, calcium, and tropomyosin. B. Troponin C, troponin I, and troponin T. C. Troponin I, actin, and tropomyosin. D. Troponin C, myoglobin, and actin. Time is up, guys. The answer to this question is B. Troponin C, troponin I, and troponin T. And you can find this on page 28 of your Success textbook. Remember, troponin is a cardiac marker and it is used to check for acute myocardial infarction. And there is something called CKMB, creatinine kinase, CKMB, troponin T or troponin I, and then sometimes you can include myoglobin, but not all the time. So those are the cardiac markers used to check for acute myocardial infection. And with that being said, we've come to the end of this video of practice questions with me on chemistry, and stay tuned for my next video. We'll be talking about blood bank and practice questions on blood bank. Don't forget to like, comment, subscribe, turn on your post notifications so that you are notified when next I make a post. And don't forget to share this video to your friends that are preparing for the exam so that they can get to solve practice questions every week and get better with each practice. And I'll see you in my next video. Love you all.